Okay, it is Thursday, October 8th, 2020. We'll call a meeting to order. Please stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And I think we will forego all this. We probably ought to introduce everybody because with the mask on, I'm Sam Bushman, I'm presiding commissioner.
Jeff Helser, Eastern District.
Chris Shepperly, Western District.
Kristen Bearhorse, Cole County Auditor. I think I contacted you all.
Okay.
Yeah.
I'm Karen Hayes, I'm Regional Vice President for Consult.
Mike Hyde, the CNO of St. Mary's. I'm Peter Laskowski, the Chief Administrative Officer for Compass Health Network.
I'm Dr. Crystal Sullivan. I'm the CEO of the Community Health Center of Central Missouri.
Tom Lubring, Chief Financial Officer at Capital Region.
I'm Becky Miller, the COO of St. Mary's.
I'm Joe Miller, Community Health Center of Central Missouri.
Okay.
So we had multiple applications through CARES for funding for testing. So we wanted to get all these guys in the room and they can give you a brief overview of their application. And if you guys have questions or things you want to talk about, this is the opportunity. And BKD is on the call as well. They are virtual up on the screen. Hi, Julian.
You're on mute. You can read my lips. Good morning, everybody.
Good morning.
And I think Christy's joining from the health department as well, virtually.
Okay.
Morning.
Good morning.
All right. Okay. So do we want to just have
Eeny, meeny, miny, moe. You pick someone to go first.
ladies first? Oh,
Right.
to Peter, okay.
Well, like I said, my name is Peter Laskowski, and I'm the Chief Administrative Officer for Compass Health Network here in Jeff City. We have locations in 47 different counties in the state, and we have behavioral health services, primary care services, and dental services. In many of our locations, we serve as the federally qualified health center in those communities. Here in Jeff City, it's obviously the Community Health Center, Dr. Sullivan and her team there. We serve as a safety net provider, as they do too, particularly for persons with mental illness. And our mission, Inspire, Hope, and Promote Wellness, really becomes all-encompassing when it comes to COVID. And so we have converted a bunch of our activities to factor in the pandemic, which includes testing. We've tested to date more than 8,000 individuals just throughout our service area. And part of the model we have used is to conduct community testing events. Earlier on in the pandemic, we saw this happening elsewhere, and we're able to have some resources to step up and get that going. And we've put in similar applications as we did here in other counties for their CARES Act money for such events. We've go all the way over to Cass County in the west, all the way over to St. Charles County in the east, a little bit north, a little bit south. That's kind of our reach. We have a little bit of a difference now. We put in for $100,000 just kind of as a round number, thinking we could test up to 1,000 individuals in Cole County over the course of 2 different events, 2 different days, where we would have our staff at one of our clinics here in town, and it could serve up to 500 individuals that day, both through appointments and any walk-in traffic. That was based on a cost of $100 per test. Those tests would all be specimens that would be taken and sent to Quest Diagnostics, our lab company, for the polymerase chain reaction, the PCR test that everybody's heard about, and that has had some delays over the summer. Typically returns a result in around 24 hours. Over the summer, when they were crushed with specimens to analyze, we saw results coming back as late as 13 days later, which makes it really hard for folks like Director Campbell to try to oversee quarantines and stuff like that. And for us at Compass and for our colleagues here in the room and for everybody as employers trying to get people back into work, particularly for us and for our colleagues, serving people who have nowhere else to go, and things like that has been really difficult. So at this point in the process, we have a great capacity to do the rapid test. There are two different kinds of rapid tests that we've been able to acquire. They're not the only two on the market and approved by the FDA, but we've been able to acquire those. And so I think the only thing I would say today different from our application is if the commission were so inclined, we would probably want to modify our application partially for the cost, because the rapid test is cheaper than the Quest PCR test. And we don't know at this point whether it's better to have an event or to try to work together, as I know the commission has considered and the health department has considered and others have considered, to try to set up some kind of a sustained testing center. But we'd be interested to see if that is in the offing as well. But at this point, we're still capable of and willing to test up to 1,000 individuals on again 2 different days. We've got the staff kind of earmarked to be able to do that if the commission would want us to do that, and we would just be doing the rapid test this time instead of the Quest test. The results come back in about 15 minutes, and we report those to the local public health agency, the results of those when they're positive, so that they can do their job. And so I think that's what we were proposed to do.
Where would you do the test?
Well, we have 3 big locations here in town that probably most of you all are familiar with. We have the Children's Center over on Stadium, where we share space with the Community Health Center. And it's got a decent sized parking lot, but it's right there on a heavily traveled area, and it's got a hill going up to the parking lot, so it's not optimal. We have a location at Amazonas right next door to the West Y, and we have a good sized parking lot there. It's a less traveled area for us. But our big clinic here in town is on Metro, kind of behind the Sonic and behind the Department of Corrections there. And we've got, again, a big parking lot, and would probably try to do something there where you can go behind the building, and it wouldn't be drive-through, but it would be kind of close to drive-through. We would try to do it, if we have weather like this, we would try to do it outdoors.
And you have an application in already, you said, for 100,000? Okay.
Yes.
Do you have capacity to get more tests than the 1,000? Or I mean, what's your supply chain look like?
Yes, it's been difficult. I mean, like I was telling these folks, we were told in March it'd be 2 weeks to get the Abbott ID Now rapid test. And we were told 2 weeks all through the summer. We finally got the Abbott ID Now, and we get a weekly allocation from them of test cartridges, the test kits. Same goes for the Becton Dickinson Veritor machine, the BD Veritor, and its cartridges. We have a steady supply weekly coming in. They were very, what kept happening, as I understand it, is that Abbott would have the capacity, or Becton Dickinson would have the capacity, and the feds would come in and say, no, reallocate those to long-term care facilities. Rightly so, because of the need there. But that's, that has thankfully been worked out, and they've been supplied sufficiently. And so now we have a weekly allocation coming in from both companies. That's for our whole service area, all 47 counties, but we're trying to do the best we can with those resources.
I don't think I have any other questions at this time, so.
Okay.
Okay.
Thank you.
Thank you.
Thank you.
St. Mary's, you want to?
Yeah, I think we'll tag team ours. Becky Miller's our CO, as she said, and Becky's actually the one that has the detail behind the dollar figures and things, but not a lot of new information. We've talked before, but St. Mary's has had an alternate testing site on our property since the early phases of COVID. As we've said before, we service not only our own patients, but our community patients. So patients who are coming to the tent include, those for pre-procedure testing for our surgical patients, some of our clinics, and then obviously a large population of the community that just needs testing for school, things like that. Dental procedures is another big one we talked about. So that is ongoing. You know, we've obviously tried some different things to bring a community site together. It didn't work out for various reasons, and that's fine. So we are planning to continue that, as I know that our partners over at Cap Region are as well. So our application was really just to cover the cost of the tent that we could as clearly identify as community-based as we could. And I think our total was $312,000.
$319,000 total application.
So, and really that's, as I said, just to cover the costs that we have for serving the community with our testing site that we continue to have and are planning to continue to have.
Yeah, and if I could just tag on to what Mike said, we are definitely interested in moving forward with, you know, expanding the testing with our partners in town. Is it on? Yes?
Yeah.
Hello? It's hard to talk behind a mask. Okay. Yeah, as Mike had said, we're definitely interested in moving forward of what we could do to collaborate with our partners here in town. As we looked at the application and submitted some questions, it was clear to me and confirmed that the application was for reimbursement of expenses. So that's what our application is for the reimbursement of some of the expenses that we have incurred in the tent that Mike had mentioned. We have tested about 11,000 patients since March. Recently, because of the allocations and the limited supplies with some of the reagents, we had to kind of prioritize that testing, which we would really hope that we could expand past that. So we are looking at those options by using a different reference lab than our own, which we're currently using in St. Louis, and that would allow us to be able to expand the number of tests that we're doing and be able to test more asymptomatic patients. So this is a 6-day-a-week operation. It has been since the beginning. So what you'll see in our application, as I mentioned, are the reimbursements for our rapid testing machine. We use a Cepheid. We have had that in place at the hospital and have been able to use that for those prioritized tests. The various assorted supplies and such that go along with that. One of the other things that we are looking at, knowing now that we're going into inclement weather and needing to continue the testing, we have been doing that out on one of our side parking lots. We are looking at moving that so that we can have better coverage and protection for our staff who are out there actually doing the testing, doing the registration, as well as for those coming through the tent. So some of the other pieces that we have in our application is to do that. We're getting ready to move over. There's a carport, there's a tent to replace the one that is worn out because of what we've been doing since March. So we have some of those pieces also in the application, along with reimbursements for those, along with reimbursements for the testing supplies and various assorted PPE, et cetera, that we have been using since March. So with that being said, if there were an option for funding that could go into the future, we would be very interested in what we would be able to do with that funding with our community partners. Any questions for me?
So the 319 is for expenses already incurred and doesn't go account to what you're doing today or maybe in the last 30 days or any of that?
The only piece of that, and again, we had kind of gone into this community testing piece thinking we were going to be able to set this up with funding to go into the future, and then realized that this was strictly for reimbursement. And I did get that clarified through the CARES funding that it was for reimbursement. So it is for reimbursement of what we have done. There are a couple of items in there, the carport, the tent, some of the equipment and supplies. They're called WOWs, workstations on wheels, for people. You see them wheel around if you're in the hospital. Because we're needing to pull the equipment we had sent out to the tent back inside, because we are getting full in the hospital. So we're having to pull everything we had allocated to the tent back. So we've purchased equipment to continue to move that forward as well, and those pieces are in this application too. But they have been purchased, so it is a reimbursement.
Anything, Jeff?
No, we lost there too,
We
so.
did. I don't know why the computer is not connecting to the internet correctly.
Thank you.
Okay.
That leave me?
Yeah,
So this is Tom Lurving, Capital Region Medical Center. So similar to SSM, we have a mobile testing site, and that's what our request is based on, the actual costs incurred from March of this year through August. I will tell you that we've had it up and running with limited hours from the very get-go. The month of September, we have had to add a significant amount of staff and expand our hours. Those costs are not in part of this request at all. We continue to operate that 6 days a week as well. I know we have been working with our fellow healthcare providers in the community about trying to find ways to share some of this responsibility, but the volume that has come through in the last month is more than we can handle on some days. We have had days where we've had over 200 people come through our mobile testing site. Our averages are somewhere between 150 and 175 coming through on a daily basis. So the amount of volume there is fairly significant, and I would anticipate that as we continue to provide this service, that we would have some significant costs going forward with it as well. So my request is really for cost incurred through the month of August. That includes the cost that we pay to Quest to process the tests, but we have reduced that cost by the amount that we have been paid by the insurance companies to provide that test. So.
So how's the supply chain for testing supplies? Because we had heard, obviously everybody's struggling with getting testing supplies but it seems like you're still able to test, so obviously you're getting supplies, but is it tightening up? Is it?
It is tightening, and it's fluctuating, as Peter has referenced. It depends on where allocations are going. The government's involved, and they're allocating the hotspots, if you will. I think all the organizations, I know Capital Region, St. Mary's in particular, got very creative. We're using our own labs, we're using other reference labs. We're tapping into whatever resources we possibly can to keep up with the volume of testing that's needed. Through previous conversations that we've had, we've obviously voiced concern about that, and that we felt like the more people we had trying to acquire supplies, the better. So I'm actually very happy to hear that we have additional partners in the community going after supplies, because I think that will increase the availability to our community. So I'm sitting here trying to support not just what we're interested in for St. Mary's, but I think as many partners as we can in the community trying to acquire supplies is actually important for our community.
Yeah, this really needs to be a community effort. I mean, as you've seen, none of us have the individual, I think, capacity to do what we need to do. And as far as the supply chain, one of the things that we are hearing is, as the folks who are making all of the supplies and such, they're pivoting what they're doing, and we're looking at testing capability for more than just COVID. So with flu and COVID and a couple of other things, so as they're making that shift with that and no longer just focusing on COVID, we unfortunately are thinking that some of those supplies may actually decrease. So that's something we're watching very closely. We obviously need all of the testing, but we want to make sure that we're not decreasing our ability to do the COVID testing.
Correct.
So that's why it's fluctuating based upon the suppliers and nationwide, so.
And just to illustrate further a little bit, if I could, the instruments, the testing instruments that we have, the old Alere machines that are now Abbott machines, they're the ones we've used for flu and for strep and for RSV, and we've had those for years. And so you could see how that's all coming out of the same, chain that's now being, asked to produce all this COVID testing functionality while still producing all the strep, RSV, and flu that we're going to need, especially now. So it's really going to get perhaps difficult.
Well, I just want to drive one more point home that I know we've talked about before, but since you asked, you know, our allocations are based on historical use, and our historical use for those types of machines has actually been relatively low in the scheme of things compared to St. Louis or some of the other bigger hotspots. And the interesting thing that we see, because, you know, SSM is in St. Louis as well, you know, St. Louis was kind of a hotspot for quite a while, and, you know, our COVID volumes were relatively low. That has flipped on us at this point. The SSM hospital in Jefferson City is probably the second highest COVID, you know, volume in our system, even well above our St. Louis hospital. So that means the prevalence of COVID in the community is going up, our need for testing is going to go up, but because of our historical allocations and government decisions being made based on that, testing supply availability is still a major concern for us.
Yeah, what I'd add to that is, and it does vary depending on what type of tests you're doing. So we had just recently received our Abbott machines to do a point of care testing. We're hoping that we could deploy that out to all of our physician offices, and so try to move some of that volume from the mobile testing site into our clinics. But we're having the same issue of getting the material that we need to do the testing with the Abbott. So right now, we're only doing nasal and nasopharyngeal swabbing at the mobile testing site. And right now, our supply for that still looks pretty good. But if you've had the nasopharyngeal swab, you probably wouldn't want to do that one twice. So I think we're looking for better means of testing that are more patient-friendly. And those are the supplies that are hard to come by at this point in time. So I don't know that today any of us would sit here and say that our supply is not adequate to meet the needs today, but that may change in the future if the supply chain reverts back to limited access.
Well, and it's our demand for
Yeah.
increasing.
So I know at one time we had talked about trying to do a testing center at the old health department, and that, we couldn't get together on that. But we're still talking like you're doing testing, you're doing testing, you're doing testing. Is that the best way to do it, or is looking at doing a joint testing site more effective, or would it be more effective?
Well, it'd certainly be more efficient, and we talked about that. You know. Staffing it would probably be more efficient. We could probably handle more volume at a centralized location than what we currently have. You know, the other advantage to adding another testing site, you know, I think as we talked before, SSM and Capital Region Community Health Center would continue doing testing and add a community-based testing site on top of that.
Okay.
As I was saying before, I think the more testing sites you have that are acquiring allocations of supplies, the better the community will be. Because each individual location is only getting a certain amount. The more locations you have, the better the community will have access to.
And if you want me to speak on what we were proposing too, I don't know if that would help in the discussion as well.
Sure.
But for the community health center, what we were proposing is a 33-foot testing trailer. It's a customized trailer built for specifically for this type of thing. There have been other health centers in the state that have also went forward with this. It's through a company called Lifeline. We've already purchased previous mobile units from them. We have a dental unit that provides dental care to children while they're at school. So we have a history with this company. This 33-foot trailer would have 4 patient care areas. Each one of those patient care rooms would have a chair and a separate entrance for that patient to be able to come in and have their own self-contained room with a HEPA filter. Then the central area would be where staffing would be housed, and we would also have the capabilities if we needed to run the rapid machine test, we could do that. Again, supply is going to be an issue for us as well on that, but we also use LabCorp, and they have about a 48-hour turnaround time for those tests through LabCorp. The point-of-care tests are antigen-based tests, So there is some concern on if you're doing an antigen-based test versus a PCR test, without getting into all the specifics, but there is a little bit of controversy on those two different types of testing. So we would be able to add some additional testing through this mobile unit. As a federally qualified health center, we take care of the underserved patient population. So patients that may not have transportation to get to our clinics, may not have transportation to get to either one of the testing sites. This would be a mobile unit that we could take into the community. If we had a need in a certain area, we could set this up. It's pulled by a truck, set it up and do a testing event if we needed to do that. It would also be allow us to be able to do immunizations when those come available. When COVID immunizations come available, this will be equipped with a refrigerator and freezer as well, medical grade, to house vaccines. It could also be used in times of flu vaccines or other vaccine events that we would need for the community. We do participate for the last several years with the Jefferson City Public School System, and we do immunization events at back to school time. So it could also be further deployed for other events down the road as well. Or if there was another natural disaster or something where we needed to set up a quick site, quick clinic type setting, we could do that as well with this site. And so that would give us a little bit more of an opportunity to do a little bit more testing. Right now, our parking lot situation on our Christie Drive location is very limited. We don't really have the capabilities to add a drive-through site at that location. So all the testing that we do is more in the office-based setting. You know, we do have a mobile unit that we have parked outside of our clinic that we can do that type of thing in that mobile unit, but it stays there on that property, and it's only one exam room, whereas this would have 4 that we could have a higher volume.
So would you set it up at different locations, like weekly, like say, or
Yes, we could, and we could work, with the health department. If there's a hot spot or a specific zip code that is seeing a bigger spike, maybe we set it up in that area, or maybe we identify that the underserved population who maybe can't get to our clinics or can't get in to be tested, we could take that to them. So we could move it week to week if needed.
I know we got an email yesterday from Christie where DHSS has some tests that we're getting for our schools. And so I said, some of our private schools, parochial schools, they don't have nurses. So could this be used at the schools to?
It could potentially. Again, it goes, kind of back to the supply and the demand and the staffing. But we've done events like that with some of the mental health, facilities. We've gone in and we've done testing for all the residents. So yeah, we have done similar things to that.
Okay.
So do you have the staffing currently to run that trailer?
Well, we're trying to beef up staffing as everybody is, because we anticipate that we're going to go into the flu season, and then if you get staff that's on quarantine, or you have staff, that's a real struggle. So we are trying to beef that up so that we can do that.
Dr. Sullivan, if you have that set up and you go into a facility to do testing, will you do flu testing as well, or just COVID-19?
We are looking at doing both flu and COVID. LabCorp does have the capability to do a nasal swab that will get both flu and COVID testing done. We're still trying to wait on the specifics of all of that because it's kind of the newer technology that's coming around. But that's the plan.
So your application is for the cost. What about the cost for the tests that you administer?
We are not asking for any reimbursement for the cost of the testing, just the testing trailer itself.
Okay.
So I'll add a comment to this. Right now, as Mike was sharing, we have a lot of infiltration of this disease in our area right now. And all of us have a system set up today. Trying to replace those with one system, I think, will be truly limiting the access, and I'm not sure that anybody would be able to handle that kind of volume. So I think it's all of these things put together is what's going to meet the needs in the community. It's our primary care offices being able to do this testing and giving out the flu shots. And these other things that we're doing are really there to help improve the access, because not everybody can get in to see their primary care provider to get this stuff done. So I think it's gonna have to be more than, one facility set up. The university up in Columbia had to set up 2 mobile testing sites because they couldn't handle all the volume through their one. And so to try to limit what we're doing, I think at this point in time may be self-defeating because of the amount of volume we have. When we originally started these conversations, we were seeing 40 patients a day coming through our mobile site, which meant that our staffing was somewhat inefficient because there was downtime. That's not the case today. We actually had to put more resources in because we just couldn't keep up with the volume. So trying to consolidate it all into one right now would seem to me to be a little foolish because I just don't know that we have any place that could handle that kind of volume. So I think it's looking at all the various options together to solve this issue.
I would agree with Tom, because each one of us are seeing a little bit different population. The population that Crystal serves, I think that would be extremely helpful, and the population that Compass serves. We have people from the community, but we also have people who are coming to us for pre-surgical COVID testing, or they're requiring pre-surgical COVID testing for a dentist in town. So we just have all different kinds of populations, and I think by having the effort amongst all of the providers is really going to give us that latitude to better serve those communities. And I think with Crystal's proposal, Dr. Sullivan's proposal specifically, to be able to go out to those populations where we have outbreaks, I think would be extremely helpful, because our already taxed health system hospital folks have been called out to do that, and it's really tough to do that. So that would add a breadth to what we currently have available in the community.
And part of the challenge I think that all of us face, and I know we do too, is like, this is all on top of people's underlying things being exacerbated, perhaps by COVID. So for instance, we have a mobile unit at Compass as well, and we use it for dental procedures and for psychiatrists to see patients who are hooked on opioids and need Suboxone, which is one of the medications that's used to help wean people off of opioids. Well, we've seen substance use disorder cases go through the ceiling. We've seen anxiety and depression go way up in our existing patients and the numbers of patients. And so the ability to staff something like this on our own and not pull those people away from those other very pressing acute needs that our clients have is really a challenge. So I think I would echo what folks have already said about collaborating as being really important.
It'll be quicker if we just keep things the way they are. It's just, I didn't know if that was something to bring back on the table, but it's gonna be a lot quicker if you do yours, you do yours, you do yours, you do yours. And, testing, that's the first line of defense for COVID, so,
So, Crystal, does that trailer, does that include a generator in it?
It does have a generator, a diesel generator.
So then I just want to go back to some other conversations we've had in the past, and obviously we had some issues with dentists requiring patients to be tested. I don't feel like that's something that we should be paying for through CARES. I mean, if that's just like, people coming into the hospital that need to be tested before they come in, I feel like that should be charged to their insurance or wherever. And then also, non-Cole County residents. And I realize that's probably a bigger challenge, but, we set up all this testing, and now we got people coming from all over the entire area into our county. And not opposed to that, but where's the other counties and their CARES funding to chip in for that? And so how do we say, okay, we're setting up testing, you guys need to participate, because I know there's not testing and probably not much in Miller or Montauk or anywhere else. So just not sure how we handle that, but just some of the conversations I've had with other county commissioners is they don't think they're going to spend their money either. So,
You know, so this process for submitting here at Cole County was pretty easy. We have not submitted requests to the other counties, mostly because of the location of this site is here in Cole County. If the commission is suggesting that the portion of the cost associated with Cole County residents is something you would entertain and we need to go to the other counties, I think we would be willing to do that. We would like some coordinated effort because, you know, these processes are very cumbersome. When you start thinking about the people that we're seeing, we're probably getting patients from 10 different counties coming through our mobile testing site. So it becomes a kind of a paperwork nightmare to try to access all those. That's not your problem, that's our problem, but any assistance from the county to help us navigate that would be fine. I don't think we have an objection of going to the other counties to get them to pay for their residents that are coming, but I know we're seeing from a lot of the other counties as well. I'm assuming you are as well.
We are, and at times alluding to the complexity of trying to split up the costs to different counties. I mean, you're having to track who it is, where they're coming from, what procedure they're here for with demo, if we're saying we're not going to pay for demo, and start putting it into these different financial buckets. I mean, it is a statistical tracking nightmare for the front team who is ultimately, as Tom's saying, 200 patients a day, you know, in and out. It won't be easy. Not that it can't be done, but it'll definitely not be easy.
so I think the concern is obviously, say we fund everything that you guys have asked. We're gonna have an influx of people coming in, and so, yeah, the tests are gonna go up because, hey, go to Cole County, it's all free. And so, I mean, therein lies a huge problem, and especially if we're paying on a per test basis or something, if that was the case, that, you know, where does it end?
So our application does not include that cost.
Right, yours is reimbursement.
It's reimbursement for supplies, equipment. For the patients who do have insurance, we do bill insurance. Of course, there are lots of people who don't have insurance.
Right.
And even the insurance reimbursement does not cover our cost for the test cost that we get. So that piece is not included in our application. It's just strictly the equipment and supplies.
And I think I heard Crystal say that was similar in your application. I don't know about Tom's, but I think
So
we're
ours
talking
is
about
different.
establishing infrastructure of the testing sites, not necessarily reimbursement for the kids and things themselves, if I'm hearing everybody correctly.
Yeah, I would be the exception. There is the cost of our Quest fees and less the reimbursement that we're receiving from insurance in our request. Since we're outsourcing all of that test, we're actually paying more to Quest than what we get paid by insurance carriers for those tests. That's why we were seeking alternative methods of testing, so we're trying to bring that in-house with this point of care testing methodology to eliminate that issue.
So in everybody's applications, but Cap Region, you're just including costs of materials and supplies, not really the cost per test.
As Becky was saying, tents, computers, those types of things. You know,
But Compass would be,
Ours is purely the test costs and a little bit for personnel.
Right.
Because we already have the equipment through other sources.
right? Okay. Definitely giving us a lot to chew on.
You're welcome.
Well,
It's a lot, yeah.
but yeah, like I said, testing, it's our first line of defense. That's, you know, and with winter coming on, and then we've got influenza besides the COVID, so it's kind of like, what do you do if you test them for COVID? They don't have COVID, but they've got symptoms. Are we going to test them for the influenza too then, or? I mean, it's
Typically, and that's what it sounds like most people are doing.
it's going to be an interesting fall and winter.
So do we think if we get multiple things going that our allocations would increase? I mean, that's kind of what I'm hearing,
I
possibly.
think that is the strategy that we're all supporting at this point, yes.
Now, if volumes recede to what they were, say, 2 months ago, then I would come back and suggest that maybe some form of consolidated to make it more efficient. You know, staff standing around waiting for the next car to drive up is not efficient. And that's kind of where we were at several months ago. That's just not the case today. I suspect at some point in time we'll get back to that, but it's not right now. Would you agree, Mike?
I would, you know, I think just based on how the epidemiology of COVID works, you know, I've not seen the latest numbers, but it's 2 point something. So every person that has COVID is potentially going to expose 2 point some other people. So the more prevalent it is in the community, the more it's going to spread. And it is definitely here. You know, we're seeing the numbers. It's probably going to get worse before it gets better. You know, the projection models that we're seeing definitely shows our area as a hot spot. You know, you've probably seen in the news that, you know, our area's been in the red zone. It has every possibility of getting worse than it is right now. It's pretty bad right now.
Say we would do the trailer and you cover other counties. So if you go into Osage County, will they, how will you get paid?
Yeah, I mean, other than the
Their
cost
health
of the-
department,
the-
or-
If you guys would like us to try to reach out to them for other CARES funding, Cole County is our biggest clinic, or our biggest county that we serve. We do serve the other counties, but we also have other mobile units as well. So, I mean, we could always take something else out to one of those other mobile units out to a different site and just kind of swap them, keep this one here and move something else out there.
Well, I know, you know, Osage, Miller, Monto, they don't have hospitals. So this is where they're gonna come for tests, so,
And we are looking at getting the point of care testing out to those clinics as well. We're just waiting, we have the machines, we're just waiting on enough reagents to go out, to be able to do that out there.
Sam, I did hear from the Miller County Health Department Director, and their FQHC, their federally qualified health center, provides testing in Miller County for free. So I don't think we get as many from Miller. Maybe if they're coming up for a procedure, but not just if they're sick.
Well, I think Tom was saying this earlier, and I know it's true of SSM. We are, the hospital systems here are putting testing capabilities in the clinics we have, which are in those outlying communities and counties that you're talking about as well. So we're really trying to promote that if we get a phone call, go to your clinic in your community versus driving all the way to Jefferson City for this. So that's out there. I think it would be important for everybody to promote that as well, for the same reasons you're saying. We don't want to overload a testing tent or other location if there are resources within their own community.
And one other thing to keep in mind, I think, for all of us is we don't know when a vaccine is going to come out, but we do know that there's a big difference between when a vaccine hits the market and when it hits the critical mass of people having taken it to have an effect. And that's where I think we're going to rely on the same, network that we have right now for testing to administer that vaccine. And that's going to, hopefully that will keep us from having to be in this situation next year this time.
And that is our plan as well.
Mm-hmm.
I think if we can all work together, if you can all work together, I think that's great.
I guess just one more question. So we're still testing people that are, that have symptoms versus people that don't have symptoms, or we're testing everybody?
Well, our current strategy at SSM is symptomatic only. They have to pass some sort of screening or a physician order to get the test. And that's literally because of the limitation of supplies we have. We don't have a choice other than to manage it that way.
So Kristen, one exception to that might be, we saw this whenever kids went off to college. A lot of colleges were requiring a negative test before they let them in. And we're seeing some employers doing the same thing. So I can't sit here and say we're 100% that way. There are exceptions to that rule, but it's not the majority. It's a small piece of it. So.
Well, the other thing, I mean, I was referencing primary care physicians before, but, you know, Sam, you mentioned that testing is the front line, but the test without follow-up care of some sort is kind of sort of useless. You know, if you test positive, then where are you at in the, you know, process of COVID? Do you need to be admitted to the hospital? Do you just need to be followed? You know, do you need to be on certain medications? The test is only one thing that gets you into the type of care that you need moving forward. So that's why we're trying to promote, you know, patients going to their primary care physicians and those so they can get care, not just a test. Because COVID is a serious disease.
I appreciate all you guys coming and answering our questions. Sorry if they're somewhat redundant. You guys live this every day, so.
Julie or Leanne, do you guys have any questions?
No, I appreciate you asking. I don't, Liam.
No, I don't either, thank you.
Okay.
Thank you very much.
Okay, thank you all.
Kristen, what do we have on the medical centers? Is that $500,000 for reimbursement?
I think in phase 3 it's 1.5.
Well, I saw that on here, but then on the other ones, I thought we had,
Well, so we had phase 1 and phase 2.
so I don't know, I've seen different things in my notes. I had 500,000, then there's additional 750 for testing. And so today, were we?
If I can I'll just chime in. So with
Okay.
phase 3, what we've done is we've just kind of collapsed everything into this new phase.
Okay,
So that $4 million allocation, which I believe for the testing is 1.5 million.
okay. So then today we were, I mean, we kind of talked about both in reimbursements and future testing, right?
Kind of, yes. So community health centers trailer, obviously, and Compass Health are additional testing beyond what's currently happening. St. Mary's and Capital Region is reimbursement for testing that's already happened.
Okay,
And possibly ongoing. So they could apply again with additional costs based on that site still
they
running.
could go get a trailer too, for that matter, if they wanted to. or-
Sounded like they already had one, maybe.
So,
And so again, with phase 3, we've allowed the applications to move forward without the, it already being purchased. And then if we can consider the application eligible and you all approve it, then at that point, I mean, they could either go ahead and purchase it on their own or they can wait for the approval and then they'll purchase it either way.
correct.
So the 4 applications that have been received from these for a total of 1.8 at the moment. If you would fully fund the 4 applications that are on the table.
Okay. Those were submitted in what, phase 1? Was it phase 1 or 2?
Two.
2.
But the only, like Cap Region said, they were including the cost of testing, where St. Mary's was not.
I think you could say, like, if you can give me a percentage of your people that are Cole County residents, you could fund a portion of the testing, just fund the percentage that's Cole County. I mean, it doesn't have to be exact, but if you say, you know, 50-60% is Cole County residents, I'm only gonna fund that portion at that percentage. You have options as far as how you would do that. I mean, you don't have to fully fund that portion.
Well, but we're talking about expenses from, well, with the exception of 2 of them, talking about expenses that have already occurred, you know, March through August. We aren't talking about anything that's happened September through the end of the year.
And I guess Compass Health Health is deciding at this point if you feel that 1 or 2 day testing pop-up is something needed or not. I don't know, Christy, do you have any thoughts on that? I mean,
No.
Well, I think that, you know, the 2-day testing events like the National Guard did, those were good when we were trying to establish like how much COVID is in the community. But at this point, we know it's here. I think that the long-term solutions are a better use of our money. And also, they sort of made a good point to why those events aren't great, because if these people are sick, I mean, you will have some people that just go get a test because it's free. And they don't have any symptoms, they just want to go get a test. But the people that are sick and are going there to get a free test because they're sick, they need a doctor to follow up with them for care. So those 2-day testing events sort of go against the argument that I think was it Tom was making, or no, Mike Hyde was making about people needing medical care because they're sick.
Well, and then the mobile trailer, I mean, that could be a regional asset or something similar to a lot of our other things that could be used by other counties if need be, or if there was some other event, or we needed to set something up.
I agree with that, and I think that if we have to, well, we will be doing COVID vaccinations, and we can work with Crystal, so I guess it just depends if the county wants to buy it and have it, or have the community health center buy it. But, you know, they have clinics in Fulton, Lynn, and California, so they serve 4 counties also. So if you had them buy it, you know, they could use it in the whole service area. But I think that is something that long-term we would be able to use, like I said, for vaccinations or other natural disasters.
Well, so that's what I was kind of meaning by regional. They could still use it in those other areas, but it'd be kind of like our MEOC in that it's a regional asset and could be used in the regional planning commission, or our 5-6 county region here in central Missouri. So Osage County, wherever it's needed.
Right.
so do you see that trailer being a county asset?
Well, that's what we're trying to decide. I don't, if Kristen could use it for other things, then it might be worth,
Our issue with like the testing would be the staffing of it, but if we could partner with them for the staffing, and then just the logistics of parking it and pulling it and all that, I guess it just depends, like I said, if you want it to be a county purchase or you want it to be a community health center asset purchase.
what is your personal opinion?
My thinking, well, if it's a county asset, then it should probably be through Sierra, or maybe, you know, something where we keep it with our emergency management director with the other assets, because then it can be used for other things than just health department issues. But we could definitely use it when we start doing the vaccinations. I mean, we probably could have used it a little bit this week with some of the testing that needed to happen at the jail. I mean, it would be a good thing to have. But do we want to maintain it long-term, or let the community health center take care of that?
That's my thoughts, and it sounds like they may have more uses for it than it's sitting with us. Like, say COVID's done, do we have a use for it unless we have mass vaccinations or something like that? It sounds like the community health center could have ongoing use for the trailer.
So could we
Even
give
beyond
it to
COVID.
them, but work up some kind of agreement where?
Well, if Christie has a use for it, then,
Yeah.
you know, you want it to be dual use, and you want it to get used as much as possible. So versus something sitting in a parking lot somewhere, just, you know, collecting dust, and generator never gets run, and.
Well, the maintenance issues of it sitting would not be good.
Right.
Well, and I think the community health center would use it more like if they used it every year for when they go and they do like the Tdap and meningococcal things like that at the back of school fairs. But if we had some other mass vaccination event like they did for H1N1, or like we might have to do for COVID, if we could work out an agreement with Crystal to where we would partner with them, that would be ideal.
Yeah, I'm not saying one way or the other, but I mean, obviously I think it could be dual use.
Yeah.
Okay, so what are we gonna do? We're gonna make any decisions on any of this today, or are we just gonna move forward and?
Julie and Leanne, do you see any issues with the trailer qualifying in total?
I don't at this time. I haven't seen all of the details, but I think it could make a lot of sense.
I mean, you.
Yeah, I agree.
And then have you reviewed the other, well, so one's just the 2-day testing, which we're not sure about at the moment, but the other 2 applications, have you reviewed those in detail? Do you see any items that are not eligible or anything on those 2 applications?
So I looked at the St. Mary's one and the Cap Region. So the Cap Region one, it is $616,000 of kind of reimbursement costs is what they're asking for. And then going forward, they have budgeted, I think it's about 120 some thousand each month for September, October, November. I think they put this in early September. But they didn't provide a ton of breakdown on what all is included. Is a lot of salaries. There are some purchase services, so I'm guessing that's the testing, some other items in there. So we don't have everything with that one to make sure that it's all COVID related kind of things. So we would still need to get some information if we did do the reimbursement. Now that we're doing it in advance, if we get them to kind of certify that all this is COVID, we could go ahead and start with that process. With the St. Mary's one, that one is almost all reimbursement. They got me, I want to say about $270,000 worth of the invoices out of the 319, I think is what it is. So that one is almost all fully looked at and determined to be eligible. So there was just a few invoices in there that were first kind of like, I think some PPE-ish stuff that they didn't throw in the invoices. They just put in the really big invoices for us to look at.
So do you guys want to possibly put those on the list for Tuesday? You guys can have some time to think about them, and if you have more questions, they can bring those forward on Tuesday and even decide yes or no, or do you want to decide yes or no today?
I'm not ready today. I mean, just the conversation that we had, I'm concerned that, testing may go up. Obviously, if we add more testing sites or whatever, it's definitely gonna go up. What's that future expense look like? I mean, what they've requested to date may be a drop in the bucket compared to what may be coming. And so, if we only have, and I haven't seen all the numbers, but we got $1.5 million there, but have we reallocated everything else that we?
We have not.
Okay,
So we still have some funding set aside in contingency. There's definitely some in internal that we're not sure that we're going to be using.
Right.
And we actually, I think some of the money that we put in internal was for testing, just not knowing if it was going to be contracting with someone else or whatever. So I think that there's definitely money in our internal dollars that were for testing, because we thought at one point we could possibly be contracting for that testing.
And I think if we get into phase 4 and if we have a big spike and you end up with people with influenza and COVID, I think testing is probably still one of the most important
Well, so I think another
uses of
option-
care money.
Another option could be at the moment that you limit the amount per entity. So if 328,635 is for the trailer for community health center, you could put a limit on the other 2 hospitals at the moment that's the max they can get. And then you, down the road, if they have additional costs, you could reallocate more to it. I mean, you could say that at the moment, the max I'm going to reimburse you for cost at the moment is $328,000.
So we got 1.5 allocated, and we have 1.8 in requests already, and
Yes.
that does not include future testing, correct?
Well, so the capital region request includes,
Well, no, I meant for our reimbursements that we're looking at allocating. That's for either reimbursement or future testing, 1.5 million total.
that's what's in there at the moment, yes.
So if we do that now and disperse it with what we've got requested, then what are we gonna do for future testing? That's what we're gonna have to dig out a contingency or reallocate from other areas.
Yes.
Because I got like, I don't know, going through this, trying to figure out priorities. And I think Christie already mentioned it too, is looking at stuff that's long-term, that's gonna help us continue to do testing. Take care of the people that are sick and actually need testing. No one-day freebie for everybody to come do it, and then you end up having all these sick people too that they mentioned they'd have to do follow-ups, so. And then, obviously, a third one, and Chris hit on this too, was the Cole County residents, so. I mean, your idea of dispersing a portion of it and a certain amount to each one to help out didn't sound like a bad idea. And if nothing else, throw them a bone for now.
So it doesn't sound like we're ready to make that decision today.
How far can we punt this? 6, 7?
I wouldn't punt it too long.
Stop hunting.
I really wouldn't.
I'm ready for phase 5.
Till after hunting season.
I
Depends on what you're
was
hunting,
gonna not
huh?
bring that up at all today, because I know you're probably tired of hearing about that.
But, you know, if you reimburse St. Mary's, and if I don't know how quickly you get the trailer, if we want to do the trailer, I'm gonna abstain from Cap Region, so, but if you reimburse the two and buy the trailer, and then the 100,000 for Compass, you know, somewhere down the road, we might want to do a 2-day testing. But I don't think at this time, we're at that stage where we need to do that, so,
Or maybe there's a partnership with Compass and Community Health Center or something where we could do maybe it's not all
Yeah.
that, but I mean,
Yeah.
maybe we go
Yeah.
in and we set it up and we test 300 or 400 people or whatever.
So that was in the back of my head, is if you did purchase the trailer now, maybe it's a partnership later on if there would be a big spike with Compass and the trailer to provide that testing in certain areas.
That'd be good, like if we had an outbreak, we call it Lincoln, where we could link the trailer and partner with Compass and have them help at like one big area like Lincoln University, or even in just a public school or something like that.
that's just COVID.
Allergies.
Okay, well, let's chew on all that, and maybe they can, maybe Teresa and Julie, they can all kind of look at it and make sure and see what qualifies and give us some direction on Tuesday, and
Okay,
then we can go through this stuff today.
okay.
Good.
Okay.
So Julie and Leanne, I'm gonna turn it over to you for what you have on your agenda.
All right, so I believe, first up, we're gonna go through the funding recommendations. But, we have any food, or you?
I'll go through those.
Okay, Teresa.
So, yeah, so we're planning on doing our reporting on Monday for the quarters, including July through September. So on your list, you'll see the D1005, July through September. Those are those items that we have not previously included for your approval. So if you have things like some PPE, some cleaning supplies, there were some more, just a handful of retrofits for EMS, some technology for some telework, and then some more magazine racks just for the public people to access things outside of those offices so that they are not coming in contact.
These are
I
all-
think, and Kristen can correct me if I'm wrong, but I think this will be a lot of the items that aren't going to come in front of you for applications. We shouldn't have too many of these more going forward. They should all be going through you. In the
These are the
application
smaller
process.
items that are running through that emergency account.
Oh, okay.
So, the little things that are piecemealing in and out, and then some of the EMS PPE that was ordered prior to, but is just now being received and paid for. Those are the items there. So it's the 3 emergency accounts that we have set up in our other funds that were not applied directly through CARES.
Okay.
So yeah, that total is gonna be 27,871. And then on the DO 308, that was some expense that was in excess of the original, grant application. I think it was some, shipping to get those, PPE storage bags shipped to you, so that's 257. And then we just left on that, small business that, was asking for rent and some custom order inventory last month as well. So that's what we're presenting today, and mainly just to get that report out on Monday is what we're needing for this.
Teresa, do you think we're gonna have that reporting maybe this afternoon or tomorrow?
Yeah, as soon as I get the approval
So-
today, I was gonna get that to you.
Okay, Monday's a holiday for us. I mean, I can't
Oh,
submit it
okay.
on Monday, but if we have the ability to, we want to, do it tomorrow.
Nope, I will get it to you as soon as we're done here.
Speaking of getting things to us, I think we're getting everything that you and Debbie are forwarding to us too, so. Like the materials for today's meeting and stuff, so we'll save you an email if y'all don't wanna forward it.
Okay.
I've been getting them. You all
Mhm.
getting
Yeah.
them too?
Oh, yeah,
Mhm.
yeah.
Yep.
Yeah. just
Yep.
Save yourself an email.
Okay,
And Debbie, you too, if she's still listening.
she is.
Okay. I was making sure there
If there are
wasn't
any
anything
questions on any
different.
of those, happy to answer.
No.
No.
I move we approve D-10-05.
Second.
All in favor?
Aye. And then I move we approve D-03-08.
Second.
All in favor?
Aye. And I'm still not undecided on rent. I'm probably a no today, so.
See, I think they really qualify us, but.
All right, so,
If you guys wanna-
anything else, Teresa?
You guys want to approve that, you can. I'm just a no today,
Yep,
but.
like I said, I'll
that's
get
fine.
that to Kristen today and we'll get that submitted.
All right. So then really, we just wanted to touch on the fact that we are working through the subrecipient monitoring protocol. So my thought is kind of getting through next Tuesday, whenever we have available for you all to review, and we'll pull together additional information on the testing priorities as well. Then on Thursday, probably just give you an overview of what our subrecipient monitoring protocol will look like, and what that process will be. So that would be then on Thursday. And again, as I mentioned, for the county, you only have to really go one level down to be in compliance with the CARES Act. So I think we had some discussion, if somebody does a sub-award underneath you all, then you're protected through those certifications that they're making through the subrecipient agreement. However, on this test basis, we will be asking questions, and if, we don't have the obligation to go further. However, if we come across something, we would certainly, make you aware and ask the right questions. So, that's where we are.
So just a couple of questions before you go. So, are we working on, some of these for municipalities and some of these others on the list? And then also the ones for, that we said that weren't eligible in phase 2, the small businesses, are we gonna relook at those, or are you waiting
Where
for
did it
guidance from
go?
us?
Yeah, so we're actually, everything that was kind of in the queue through phase 1 and 2 that had not been, maybe they hadn't purchased it or didn't have the receipts, we're gonna go ahead and contact those folks and let them know those have been moved forward into the review process of phase 3. So the short answer is yes, those all kind of get collapsed into phase 3. We did say we created the press release, which is very similar, and I think you all.
Yeah, we
They're
have
gonna
it.
look at it here in just a minute.
Okay, perfect. So essentially, that's what it says, is that those items will be collapsed into phase 3, and that those applicants that have already sent in applications will be notified that their application is still being reviewed. So, yeah, all those you'll start to see those pop on to the recommendation requests. Once they're approved, then as part of our process, when I say approved by the commission, let's say they've not made the purchase, then we would go back to that applicant to work with them, for them to make the purchase and then provide us with the receipts before we make that reimbursement. So they don't get paid until they spend the money and have the receipts, but they do get approved prior to that.
So it's then some of the second to last category, some of those for lost revenue that we said didn't meet the smell test or whatever. I mean, those are not going to be, you didn't score those, and so those are still not eligible, right?
So unless you change your,
Well, that's what I'm asking, yeah.
Yeah.
I mean, currently, they're still not eligible going into phase 3 and phase 4, just because that doesn't meet our requirements. Correct?
Correct.
Okay.
And we can work with Debbie and Kristen to make sure those folks are notified as well, just so that we clear those from the list.
But the small businesses that have received other funding, that you're gonna score those, I guess, and see if they qualify?
so right now, you haven't changed the restriction on small business that if you received other funding. So no, those are still being held as well.
Right, the phase 3 guidelines still makes that requirement that they are not eligible if they've received other COVID-related funding.
So I guess that's a little tough for me. I mean, so obviously you kept your employees whole by getting PPP funding or whatever, but that may not have covered rent or some of the other things that we were talking about with some of those others. So, I mean, small businesses, obviously they need a roof over their heads, but they need employees too. Otherwise they're done. I mean, unless they're not eligible because of that other funding, I think that those should move forward as well.
So
But,
you don't want to restrict it based on other funding?
well, right now we have one small business that we're looking at. And I don't know how many others are gonna be eligible for up to $5,000, but
Well, I think there's 2 others on here under small business, but,
so if you
Yeah.
funded all 3 of those, you spent $15,000, so.
right.
Well, PPP loans paid 60% had to go to salaries, and the other 40% could be rent or utilities or merchandise, invoices you had to pay. So,
Yeah, but it was all based on last year's stuff too, so I mean, you could have had 2 employees last year and now you got 4 or 6 employees this year. Well, you're only getting based on what you submitted for last year. You're not getting what the amount of employees you have currently. You only get X amount of dollars, and it's based on last year's payroll.
So that's really up to you guys, if you want to change that restriction to include small businesses that have received other COVID-19 funding or not.
And I can argue both ways, but
I would probably, if we could still keep that like payroll,
Do we want to look at that press release, and because that's really where the language is?
yeah.
And if there is anything we need to tweak, we could go ahead and do that. If the commission wants to make that motion. and-
See, rent and utility, you don't have any problem with operating expenses. Lost revenue and payroll, I do have, I lost a lot of money being closed, but that's part of being a businessman. So how can you know what your lost revenue actually would have been.
Yeah, that's a really, and that's what we're really seeing across other clients as well. That's a really tough way, it's just hard to quantify. But if,
Just the difference in what you put on the application though, really.
recoup, that might make sense.
I mean, so you could put on the application lost revenue, but you could also put on the application rent. So, I
That's
mean,
what I was gonna say, restrictions, if they've got funding, but restrictions, that's what you will reimburse you.
Yeah,
So you could say if you've received other COVID-19 funding, you can apply, but we will not cover lost revenue or.
or payroll.
Payroll
Because
costs.
PPP originally was what, 75% payroll, 25% other, or 70-30, it was something like that, and then they lowered it because, you know, say you're a mall store, you're paying thousands of dollars a month for a store. You know, 25%'s not gonna even come close to covering your rent. But,
yeah, all,
And per the, I'm sorry, per the welcome letter, or the press release, it's only $5,000 per organization. So again, if you limit the categories of what you want to fund, it gives you some flexibility there.
I would do like rents, utilities, and there are some new businesses, they've got small business loan through the bank, because I talked to two of them, you know, and it's like, you know, to open a business today, in these times, you know, it's costing you $150,000, $170,000, $200,000 to open a business. By the time you buy your fixtures, by the time you buy your inventory, by the time, you know, it's, so you've got a business loan you have to pay too. And so, I mean, rents you've got to pay, business loans you've got to pay, utilities you've got to pay. Advertising, to me, that's payroll, I wouldn't do. Lost revenue, I wouldn't do. But that's just me.
well, so, I mean, my argument would be is that I submit the application and 90% of the businesses out there are renting. They may rent from the owner, they may rent from whoever, but they're taking rent. I mean, you know, most businesses out there are, the owner may own the building, but they lease the business to their business or whatever, and they take rent. So, I mean, you just change the qualifications, and, you know, I listened to this meeting and I just changed my application. Instead of lost revenue, I put down rent.
So we're gonna change it to, if we change it. I guess the question is, are we gonna change it? But if we do that, are we going to change it with the applications we have on file now? Or we're gonna open it back up and they reapply, or they submit the same one they have in here? Or do we just look at the ones we have now and say, okay, well, now we're gonna change the rules and you do qualify?
Well, so you haven't approved or denied any of those applications. So if you change the rules, you would still review those with the new set of rules in place.
Right, but the application is probably still open for small businesses, I would assume.
Yes,
So then other people could still come in and apply for it?
yes.
Okay.
So everything from phase 2 got moved into phase 3. So you haven't spent the $200,000 you had for small business, so it's still open for application.
Okay. Do we have a close date on that? Did we set one for that or anything?
I think our thoughts were phase 3 would run through the end of October. Is that correct?
Correct. Yeah, that's kind of been our process.
Okay.
So,
I think we have 200,000 allocated for it, and if we can get it to the small businesses, that stuff's gonna trickle down and throughout the community.
So do you want to
So-
change the restriction on receiving other COVID-19 funding?
Either that, or we're gonna be reallocating that money to somebody else, right? Either testing, schools, or whatever. So, I'm fine with opening it up.
What's the criteria, though? I mean, are you good with rent, or,
I think rent's,
I know you're good with rent.
well, no, but I mean, I own my building, so it's not, but I know talking to stores downtown, I mean, you've got,
So,
you're paying your rent.
I own my building too, but I also rent it to my business.
Well, I do too.
Yeah,
But
so-
I'm not applying, you're not applying.
Well, I get that, but
So,
I'm just saying.
but, you know, when I bought it, I had mortgage payments I had to make. So my rent that I paid, you know, now it's paid off, so I
if
don't.
it's a reimbursement, I
But-
mean, they're
but
giving a real piece of paper
I
asking for real money.
think this one that is applying right now, I think I know who it is. And she pays rent. So, and I know talking to another business down the street from me, he pays pretty high rent, and then he has a business loan too, because he's only been open about 1.5 years. So,
So do you want to
he's
put-
underwater right now.
Put restrictions on it otherwise? Do you want to say no?
No lost
payroll?
revenue, no payroll.
Well, yeah, so what we could do is say small businesses and just take out the caveat about the COVID-related funding and just say small businesses, and then we could say excludes payroll-related items, payroll and lost revenue-related items, something like along those lines. And then that, we still have the maximum of 5,000 per organization, which basically that gives them the opportunity to ask for rent, utilities, advertising, any of those things that are not payroll related or lost revenue.
I think that sounds good. I mean, I think we all agree that we don't want to do salary or lost revenue.
Right.
Now, we're kind of up in the air on rent and utilities, but they can still apply, and then when we decide.
I mean, the advertising and doing things to do online stuff, I mean, that to me is a business trying to figure out a way around all this. And so, I mean, that to me, I clap my hands and I applaud them and say, hey, figure it out, your, delivery, whatever it takes to get your product to people. But I mean, if you guys think rent and utilities qualifies, I'm good with that. I mean, but we're we're all in agreement that when we give away 200 grand, we're done.
Yeah.
Well, that's where I'm at with it.
We
If we're
can
gonna,
limit it just to rent and utilities if you prefer it. I mean, that's pretty clear for the applicant. That's easy for them to understand.
Yeah, and I just wanna, I know we talked a little bit last time about the required closure stipulation in the guidance of that's when they could get reimbursed for that, so it'd be that April timeframe. I'm still not clear, I've got a call scheduled with our guidance person to maybe get a little more information on if they could get rent for like May, June,
Yeah,
July.
that's true.
So, I don't know if I would wanna restrict that, but we did confirm that like things like advertising and things to get their business back up and going for like delivery, if they were gonna do delivery, things like that, that would be allowable under the guidance.
I mean, I'd probably be a lot more comfortable with 2 or 3 months rent with receipts. I mean,
they do have to have receipts, right? I mean, they do show something.
Oh, yeah.
Because it is
Oh, yeah.
reimbursable, so.
So yeah, I've been requesting the rental agreement, if they ask for rent.
Okay.
Yeah.
I mean, that's why I've been leaning towards it, because it's a real cost and a real loss,
Right.
if they're forced to shut down now, we didn't force them to shut down, but
right, I mean, they were shut down for what, 6 weeks? So,
Yeah.
I mean, so really, 2 to 3 months, I mean. 3
But then we
months.
were only allowed to have, 10 people or 20? I mean, when we did open, I opened when we could only have 10 people in. I was one of the few uptown, because a lot of them waited till I think it went up to 25 or something like that. But, in my case, I'm like, 10 people, I can measure somebody for a wedding, I can So, yeah, we opened again, but with restrictions, and,
So right now, we just want to exclude payroll and lost revenue.
That's where I'm at.
yeah.
Okay, Julie, can you update that welcome page
Yes.
and resend that to me? Do you guys have any other changes you want to make to that?
I think it'll be fine. If she updates it, you guys can go ahead and send it out.
Okay, and it will go on the website and I will get you a copy. Do you guys have anything else? Julie, Leanne, Teresa?
I don't, Teresa, do you?
I think that's all for me.
Okay.
So I do have the sub-recipient agreements from Tuesday's meeting, if you guys want to sign those for me.
From who?
The ones you approved on Tuesday. So it's each of the organizations that got approved for funding on Tuesday.
Okay.
You'll sign that sub-recipient agreement, that will then go to them, and they have 10 days to sign and return that.
Guys care if I do all these together?
Yep, do them all together.
Is that good? All right, I move we sign sub-recipient agreements with Capital City Area Council for Special Services, Day Solutions, United Way of Central Missouri, Cole County R1 School District, Capital City Salute to America Foundation.
Second.
All in favor?
Aye.
You guys good?
We're good.
Mm-hmm.
Okay. Julie, Teresa, Lee, and I think we're done. You guys stay put for just a minute. I have
Okay.
some old business that I need to get
Okay.
answered to do payroll. Debbie, will you stay on the line?
All right. Thanks, Julie. Thanks, Teresa.
Thank
you.
Thank
You
you.
too.
Bye-bye.
Bye-bye.
Debbie, you there?
Yes, yes.
Okay, so, Matt called yesterday with his people that are on COVID. And you guys had discussed it earlier. I think there's some confusion. So the way it was being handled at the moment is that we were paying overtime or straight time for their 80 hours to make them whole for their 80 hours. I think there's some discussion as to whether you want to go beyond 80 hours and whether they're required to take sick leave or something, or if you're going to pay them for beyond the 80 hours if they're still on quarantine.
So I think my intention was if we're making them stay home, we're making them quarantine, that we keep them whole and we're not making them take sick leave or annual leave. That we would give them administrative leave with pay. But we have one instance in here that is a special circumstance, or that one with the other 48-hour shift. But I don't know, is that,
Well, so you're going to have the people that are 324s in a pay period.
well, one
So
had
even,
624
even
hours, he
his,
said.
even his 1 week of pay is 91.75 hours. So you will have an additional whole week besides the 11.75 that you will be paying as admin leave with pay or something else.
And at this point, it would have to go there, it wouldn't qualify for the reimbursement of the withholding taxes, so it would have to be put into something like that.
Right. So we can't put it into the COVID line, we would have to put it into another pay type.
And then you would also have to figure out if you were still paying overtime for that, over 80.
So I told Kristen earlier, I'm still with making them whole. You know, if it's admin leave with pay, you know, they get paid the same salary, overtime, everything, you know.
I
This is
agree.
where I'm at.
Debbie,
I
how
agree.
many have we made take sick leave already?
There was definitely a few the last payroll, and probably the time before that.
But in that circumstance, it's not that we owe them any additional money, we just need to change it from sick leave, like give them back their accrued time and put it in admin leave with pay.
I would definitely get back their sick, but then I would have to look at them to make sure that wouldn't have been paid at overtime rate versus regular.
I'm sorry, I didn't catch that.
So this isn't how we've been handling it.
Right.
So
So we'd have to go back and correct some of that.
Yeah.
Just add back in their sick time or something.
You'd have to add back their sick and then make sure that the time they took sick wasn't supposed to be overtime.
The only other option I had for them at the time is basically you could, go to the workers' comp way, but that would be 2/3 pay. So it wasn't, because it wasn't covered under the FFRA, then it would have to go to the workers' comp part, because it's only one time 80 hours. So
That's
we
true.
were upping that 80 hours by including that in their overtime. So yeah, technically, they may not have made it to their 2-year, depending on what their schedule was for the 2 weeks. We are getting reports that are 10 days now instead of 14 days. So I'm following whatever guidelines comes from the health department as to the number of days.
Right.
So I have to go back and look at those, plus what we actually
Can you
did.
send that the link to call in?
I mean, I would probably not turn it into work comp. Obviously try to get them to do something from home if they could, whatever that may be, but, anyway.
And that's 2/3 their pay, and I don't control that, so.
Right. I mean, obviously, when you turn it in claims to work comp, that's just gonna affect your rates at a later date too. So, I mean, sometimes you gotta weigh what your cost is versus what your potential increase could be through MEM. I mean, I got a $9,000 refund check the other day, so, I mean, our,
If they report it, I have to, so. But nobody has yet.
oh, if the employee reports it,
If the employee does, yes.
that they're quarantined or that they're,
That they want to take it through workers' comp.
oh. Well, if we're making them whole, why would they do that?
Don't think they would.
Right. Anyway, that's just where I'm at. You good with that? Keep making them whole?
Yeah.
I think so.
Yeah,
Call it-
I
call
think
it
either we're
admin
gonna
leave.
be losing people,
Yeah, I think.
because
But I will have to talk about people that have, now are coming for the second round. They're the people that I was suggesting to go through workers' comp,
So you've
because
been,
they've already used their allowed 80 hours.
but we're making them stay home.
so you're gonna pay their 2 weeks admin with pay?
If we're making them stay home,
I can't hear you, you went out.
did
Debbie.
you spill your drink?
Oh.
You cut
I
out.
get work 50 hours.
You only get 180 out, yes, under the FFRCA or whatever it is.
If they come back with a second quarantine or tested positive, my avenue was to do what the city was doing, and that was to take them through the workers' comp, because there's no option anymore. If you're telling me then if they are gonna get quarantined a second time, or get positive a second time, you're willing to pay that too, then I definitely need to know that.
They could get quarantined a third time.
Yep,
Well, they could.
yep.
I mean, we're really talking about EMS, aren't we? I mean,
Yeah.
It would just safety sensitive people that would qualify
Right.
for the, workers' comp. Because of their line of duty, that more likely that's where they receive to that. But there is quite a bit of paperwork to that too on the workers' comp side. But that's the option the city's taken, this is
Christie
stand, that a few other employers have taken. If you come up with it twice, then that's where they're taking the employees through. If you guys are willing to pay for that through the regular,
I mean,
or admin with pay.
yeah, I mean, I'm still on admin leave with pay and not taking it through work comp.
And you're paying their overtime for that as well.
Yep. Just like they were here.
Are y'all in agreement?
Yes.
Now, the only other thing with that I'll have to say is.
Christie
if,
became the host when I kicked
let's-
us off earlier. I told her that.
You cut out again, Debbie. What'd you say?
Mark, if an employee was not using protective gear that the employee was supposed to be using, and did get quarantined again, are you still willing to pay for that?
I think that's a different situation there. I mean, if they're doing something that they were instructed to be wearing proper PPE or something else, that would be almost disciplinary, and I think we'd have to look at that differently. Just me.
I don't see Matt waiting in the waiting room. Do I need to invite him?
I sent him the invite, but is he saying he's out there, Jeff?
Yeah. Says, please wait, the meeting host will let you in soon.
Well, if you're all in agreement that
Yes.
that's what you want to do is admin leave with pay for the whole time of quarantine, whether it's 10 days or 14 days, even if there's a second occurrence. That's what we need to know.
Yep.
Everybody agree?
Yep.
Yep.
It says, yeah, it says he's joining now. All
And
right.
that again would just be for the health department, the sheriff's department, the EMS department, and potentially maintenance.
The people that we got out there, we're basically exposing them to it.
Hello.
Hey, sir.
All right.
Hey, how are you?
Good. What? You're just getting on here, but I think we already decided that we were gonna make your employees whole.
So the only thing that it was checking, because I didn't hear the last thing, was we have one instance where an employee was put in quarantine and then left, or got out of quarantine and then had to get put back in. The reason why he got put back in is because he did not follow the guidelines within the department by wearing a mask while he was inside the ambulance with his partner. His partner became positive. Had he been wearing the mask, he would not have entered quarantine. I don't personally feel that that is the county's responsibility to pay him for that time because he failed to follow the rules of the department to make himself and others sick. He did not contract it. He's in quarantine. Had he contracted it, that would be a work comp issue. But again, I don't think the county should be responsible for his failure to follow the rules. That's on him.
So,
Yeah, we had talked about that too.
so in that
His sick time
circumstance,
vacation.
so in that circumstance, you're making him use sick time, not admin leave without pay.
Right, we're making him use sick time or vacation time because it's a failure on his part to follow the rules.
He violated
not
our
anyone
rules.
else.
Okay.
Correct, and we had talked about that one. I mean, that was a different circumstance too. We've got different things that come up, so.
Right, so the only one is that, so sometimes people can be working, so I'll use the individual that most recently tested positive. He had worked a ton of overtime from the beginning of the week. Obviously, that's not covered under the care stuff because he's already worked that. But then on a Friday, Saturday, he tested positive. From that point forward, then that's when, if you look at his schedule, so some weeks they'll work 48, some weeks they'll 72. but there's those other weeks where they work 72, 72 in that 7-day period. So the idea is that anything within that quarantine period is what they would get, whatever their regularly scheduled time was, is we would cover and not hit them, and we would make them like as treated as hours worked. If it were to go outside of that, then we would look at sick time, vacation time, adding to the pay if they ran out of those things. Like at that point, we would have to utilize what they had in the bank. The idea was just because it's an inherent risk of their job, that the initial 2-week period of quarantine, however many scheduled hours they had, right? So some person may only be scheduled 48, right? So we call it 4-day check. That's all they would be eligible for. But on the flip side, somebody might be on a 6-day check where it's a 72 week, if that makes sense.
Yep.
And Matt,
So-
this is Debbie, in the past, we were paying them up to the 80 through the COVID. And then we gave them the regular scheduled days, but it was taken from their sick if they had it. So you're saying not take that time from their sick and just pay them admin leave?
Right, so however you guys wanted to work, I think when we initially talked about it, Jill had talked about that there was a secondary funding that was able to get qualified as like a tax rebate or something that you couldn't use for that, anything beyond the COVID funding, if I recall correctly. I don't want to put it in words, I could be wrong. That then could be eligible for that piece could be eligible for reduction in tax money that we owed or whatever from county. So the idea is whatever code you guys want us to use, I don't care. We've been putting it as COVID, just for that 2-week period. And then after that, if for some reason, so we had another individual, right, that his wife got diagnosed. He refused to quarantine or isolate from her, so he couldn't start his quarantine until after she was cleared. We obviously are only paying 2 weeks because we had to pay for it because part of that is to take care of either themselves or someone that has it. So we took the first 2 weeks and said, okay, that's all you get. After that, you have to use your sick time. And when you run out of sick time, and this individual has, it's leave without pay because you are not following the health department's guidelines. And so we're trying to be fair with if they follow the rules and it's no fault of their own, then we have the conversation of, okay, this is an inherent risk of the job. But if they're not following those rules, the county should, and the taxpayer should not be on the hook for them failing to follow the rules.
So Matt, I think you need to send some kind of documentation if there are exceptions so that we know which ones should be taking time or which ones are admin leave without pay or whatever. So some kind of
Putting
document.
that in the system with admin leave without pay, when it transfers over, we've been marking that as admin leave without pay. If we know that they're in that circumstance, we've automatically been marking those, but we can go back and double check just in case when our system transfers it over and it's not pulling. I have no problem going back and looking just to make sure.
Yeah, because we've never seen any of the without pay. I mean, we
Okay.
made the day. I don't know when the pay you're talking about, but
Okay.
if it's payroll period, I haven't seen that. But before
I
this,
think one of them submitted for FMLA or tried to get FMLA for it. And I think that one, we were fine with it waiting for the train, but I don't know if they didn't actually fill out the forms. Because I know I hadn't signed anything, but that was why I was on putting orders. So I'll have to check with David on that. But I can go back. I know the individuals that should not have gotten, that we should utilize either sick time and or admin leave without pay. And I'm pretty sure that happened that way, or at least one of those variances. But I'll go back and double check. I know the individuals specifically. I can look them pretty quickly.
okay.
Okay,
Today is payroll time, so
Yeah, but we can get that done probably this afternoon. We have a meeting at the hospital here in about 35 minutes or 40 minutes. So after that, we'll be able to take care of it.
Okay, you guys have anything else?
nope.
Okay,
All right,
thanks.
you guys.
Bye, Debbie.
Bye, Debbie.
Bye.
okay,
Hey, just one other thing on that. I mean, I'm good with rent, but I think it needs to be needs to be so many months worth of rent.
Well, there's only, what was it, two
Two.
months that they were,
It was
as a
April.
mandatory shutdown period.
It was mainly April, and then I think it was first couple weeks in May, they limited us
I
to.
think it was only like 6 weeks, wasn't it?
Yeah, it was like 6 weeks, but
I don't care, I just.
a lot of them didn't
If
open.
it's 2 months or if it's 3 months, but I mean, so, somebody's rent might be $500, somebody's rent might be $2,000, but I think we need to have it kind of defined as, hey, we're gonna pay 2 months worth of rent or 3 months worth of rent or whatever
They
it
just
is.
say up to 2 months.
I think they mentioned a specific time period.
Well,
And it
she
was-
said the 6 weeks would have been the shutdown, but if you wanna go beyond that 6 weeks, like the mandatory
I think
closure.
for
See, I
this
know
phase,
one
I
of-
think limit it to the 6 weeks. If we have money left over, we can decide then if we wanna open it up past that.
I know, I think one
That's
of
my
the
problem.
applications was a restaurant, and they were open, but they were just doing carryout.
Right.
So no.
Well, I mean, I just
Uh,
think from my standpoint, it just makes it a lot easier, I mean, because, like I said, 2 months worth of rent for, a fast food restaurant on the boulevard may be $5,000 versus,
Oh, it could be more than that.
It could be,
Yeah,
yeah,
it
but
could
I'm
be.
just saying, you can't just say, okay, rent $5,000, well, is that for 6 months, or is that,
No, that'd be some, and then BKD could.
well, but,
Yeah.
what's their documentation? And we just need to give them some guidance on how much rent we'd be willing to reimburse for. But it's easier for me to swallow if it's just for that time period or 2 months.
Yeah, I mean, you wouldn't do it,
Yeah, is they're gonna.
you wouldn't do it for any
they're gonna
time
send
past
anyone
that.
With that blue.
Right, but I mean, I just don't think,
Yeah.
I don't think they had clarification. I didn't have clarification that it was more than that 2 months worth of rent. I mean, 6 weeks covers 2 months, so.
Well, and they're handling some other communities and
Right.
cities where, they're still probably closed.
Right.
It's,
So up to 2 months,
yeah.
but, I mean.
Yeah.
are
I'd
you-
say
are
the
you-
time that we had to shut down, whatever she said. If
I
it
mean,
was,
so 6 weeks would be a month and a half, so.
and they prorate it.
You
if
want
your rent's-
1.5?
If your
I
rent's.
mean, I'm good with that too. I mean,
I wanna go with the
I think
shutdown.
it was 6 weeks, and then after that, we were allowed to have 10 people. That included your employees.
Right.
And then it went, so,
Well, let's see where it goes with the,
yeah.
whatever number it was, if it was 6 weeks. And then see if we got money left over, we can decide if we
Can you
want
let them know that?
an extension on
That
that.
you wanna limit it to the shutdown at the moment?
Yeah.
So 6
Yes,
weeks.
yes.
I think-
Do you want me to spell that out in here, like on this?
It might be helpful, that way somebody may say that it's not worth me even
Okay.
going through the time to apply for, their rent could
Yeah.
be a couple $100.
I don't think
know.
it'd hurt for it to be on there. And tell them at this time, we're only going to
So-
consider
And see, there were
rent
some
for the
businesses,
shutdown time.
there were some businesses uptown that stayed closed longer
Right.
than
Saying
that.
if you were essential, you'd have been open. So I think that's a
Damn
writing
right
on
I
the wall
would.
here, buddy.
Damn right I would, yeah.
You
Now I'm
drive-through
selling, now I'm
tuxedos.
selling PPE, I'm selling hand sanitizer, and I'm selling medicinal elixir
Yeah.
for internal use.
So whiskey now? Okay.
All right.
Okay,
You guys good?
we're good.
Got something for us to sign.
No, I just want you to look at that. Sean wanted something for Friday coffee, so I gotta type that up.
All right, nothing
Right.
else?
I mean, we stand in recess till 4:30.
Second.
All in favor?